Bonjour. Welcome to our health Q&A for January 21st, 2021. As most of you know, my name is Marina McCumber and I'm the community health nurse. Helping out today with the Q&A is Bridget Prowse, our communications coordinator. I'm going to start off with giving you some of the COVID stats from Public Health Sudbury District and the province. As of yesterday, January 20th, Public Health Sudbury District reported 73 active cases and 8 new cases of COVID-19. There are 2 outbreaks at long-term care facilities at the Extended Care Falconbridge and Elizabeth Center in the Valley. Also experiencing an outbreak is a retirement residence, Amberwood Suites, and 2 schools in Sudbury, St. Denis and St. David's schools. As of today, the province is reporting 2,632 new cases of COVID-19. I'm going to pass it off to Bridget now.
Okay, so hi everyone, I'm the communications coordinator here. So just letting you know, the health team has developed an updated screening tool. So this is being utilized by all the businesses and retailers in the community, as well as at the band office. So I'm just going to let you see this updated screening tool now. So there are 4 questions that are being asked. So the first one has to do with symptoms. So if any of the patrons or anyone coming to the community is experiencing any of these, we won't let them come in. The second question is asking if people have traveled outside of Canada in the last 14 days. The third question is whether or not you have been identified as a close contact to someone that currently has COVID-19. And the fourth one is if a doctor or healthcare provider has asked you to be isolating. So obviously, if you answer yes to any of these questions, you should not be in the community or out in their stores or in the band office. So that's where we're asking our retailers to spread awareness about. So just a reminder that the symptoms of COVID-19 are all of those ones that were previously listed. And also a reminder that if you are experiencing any severe difficulty in breathing, if you have severe chest pain, or if you're feeling confused or unsure of where you are or losing consciousness, that you should call 911 because those are severe symptoms and we don't want anything bad to happen to you, of course. But a reminder as well that the majority of COVID-19 cases are mild and most people will recover on their own. So the typical treatment for these common kind of symptoms are drinking plenty of fluids, getting lots of rest and sleep as much as possible, using humidifier or maybe taking a hot shower to cleanse a sore throat. And a reminder that you can also reach out to our health team for any of the isolation supports or kits that they have available to give to you. I think Marina is now going to chat a little bit about some of the vaccine stuff that's happening in the community.
Thanks, Bridget. So with regards to our vaccine strategy, we continue to work closely with Public Health Sudbury District, Memwasing, and Indigenous Services Canada on vaccine planning. Public Health Sudbury Districts will distribute the vaccine once it becomes available. At this time, they have not been advised of when they will receive the first shipment of the vaccine. Now, I'm going to pass it off to Bridget now to talk about our COVID-19 vaccine survey.
So a survey was developed and we put that out for the last couple of weeks. So we want to also do a shout out to our communication ambassadors that have been helping us spread the word on that. So it was developed to help us best prepare for the vaccine strategy and the rollout within the community. So we just wanted to give you some of the preliminary results. We've had 76 answers, so thank you everyone that has responded. So about 70% of respondents said that they would get the vaccine, which is fantastic. And there was 30% that said they wouldn't. And some of the reasons behind this was there was some fear of the unknown, worrying that it would hurt, fear that maybe it had come out too quickly, and some people are just waiting before they make a decision. So the next question was trying to understand where people live, and so we had 40% of our respondents that live off reserve. And then from all people, whether they're on reserve or off reserve, 68% said that they were interested in getting the vaccine at our health center here in Atikameksheng. So thank you everyone, because that's really helpful to help us understand maybe if we are able to administrate, how many we'll need. So miigwech to all that participated. And the survey is still open, so if you'd like to complete it, it is on our website or on our social media channels. So thank you.
Okay, so I attended a Greater Sudbury COVID-19 vaccine implementation committee meeting. At the meeting, Public Health Sudbury District shared their phased approach to vaccine that does become in their first phase. The vaccine will be offered to individuals living in long-term care homes and retirement residences, and then healthcare workers, and then Indigenous community, Indigenous on and off reserve, individuals that are receiving chronic home care service. And this phase, the vaccine will be offered to essential workers, individuals living in other congregate settings, such as all other adults, starting with 75 and over, then 60 to 74 years, and then 16 to 59 years old. In the third phase, the vaccine will be offered to anyone else not previously vaccinated. As many are already aware, the vaccine distribution has been slower than anticipated at all levels, nationally, provincially, and locally. We will continue to keep the citizens of Atikameksheng and Anishinaabeg informed about the latest developments regarding the COVID-19 vaccine distribution process and anything else COVID-19 related. In the meantime, please continue to practice public health protocols, stay safe, and stay home. Please reach out if you have any questions or concerns. Call myself at 705-507-0134 or Carmen 5-822-3. Thank you everybody for listening, and we'll see you at the next Q&A. Pamapi.
Cheers, Bambi. Thanks.